Today I'm doing a video here. I'm desperate. I need help right now. A year ago I didn't need financial help. I was standing on my own 2 feet the best I could. Cashed out my retirement about a year ago. Had plenty of money in the bank. But because things just didn't work out the way they were supposed to, I didn't have the support. Things just kind of spiraled downhill. And then my health took an unexpected turn for the worse. So right now I'm doing a GoFundMe. We have no support, no donations. So I'm going to tell you guys exactly what I'm going through. Put it all out on the table. Because I would not wish this on anybody. Nobody should have to go through the pain that I've been through. It's agonizing. You know, people sit there and say, well, why aren't you working? Well, you don't know what I'm going through right now. Between dealing with the overall physical health issues and then the insurance. I'm on access. I have to stay on it in order to get these bills paid. So it's catch-22. So with that being said, I want to talk about what exactly happened. And I'll try to keep it as clean as I can. But, you know, like I said, nobody knows everything because it's like, can't really talk publicly about it, you know, when I'm at, you know, out, because it's kind of like, you know, but we'll talk about it the best that I can. But like I said, I've been in so much pain, like last night in and out of the bathtub, no sleep, heating pad all day. So let's just talk about it. I'm going to tell you guys what I've been through. So basically, I had what's called a perianal abscess or a perianal fistula. Don't know which it is, but in 2 days, I'm going to have a surgical examination under anesthesia. So let's talk about what a fistula is and an abscess. An abscess is basically a pocket of infection. And over time, that pocket of infection has to escape. It's like a balloon. You pump air into it, eventually it's got to pop. And that's what happened. Now, a fistula is the tunnel that the abscess has gone through. In this case, the abscess is on my rectum, which is very painful. It's a very sensitive area. On top of that, I have a hemorrhoid the size of a grape on the other side. So between the pain, the discharge, the diarrhea that I have, this is something that I would not wish on anyone. Initially, and this has been 2.5 months back and forth. This all started a year ago when my car broke down and I started to have bleeding, rectal bleeding. I've had it since I was a kid. This is the second colonoscopy I've been through. They found nothing. Like I said, a year ago, this started to intensify, but I dismissed it as stress. Months went by. It was still going on. At that point, I said I had to see a doctor. So they said, oh, it's hemorrhoids. Follow up with the GI, gastroenterologist. And because right now, because of COVID, all the healthcare, the wait times are incredibly long right now. So this ended up turning into an outpatient thing, into an emergency room situation. So now let's talk about what exactly I've been through. And you can see I've got stacks and stacks of paperwork. And on top of that, earlier on, a month before this, I had a laceration to my thumb, so I was in the ER a month before all of this started. But I've got my notes here, and I'll show you, before we do that, I want to show you this is the fistula right here, or the abscess where it burst. So I'm just going to show you guys this one picture, because, you know, it might be a little bit too much for you if you don't have a strong stomach, but that's just what I've been going through. So I had 2 anoscopies. That's basically where they put a probe up your rectum and they look in a light to see what's going on there. The first one, they said I had hemorrhoids. The second anoscopy, they said there was inflammation. I needed a CT scan. I've had an MRI of my pelvis. Those aren't fun. You have to be in a tube, and I was in there for 35 minutes, couldn't move, and then they inject you with dye. I had a CT scan done of my pelvis. They inject you with a dye for that as well, and then when they do that, you feel like you're on fire. 2.5 days in the hospital. I was admitted to the hospital when the abscess burst. And then 2 trips to the ER. So you go to the ER first, and if they determine your health situation is emergent, then they'll admit you to the hospital. But 2 trips to the ER. Technically 3 if you want to count the laceration to my thumb. I've had 2 consults with the gastroenterologist, and then I did have a consult with their PA in the hospital. 2 consults with the colorectal surgeon, 1 in the hospital, 1 out. Now let's talk about the lab work, because I've had a total of 6 times that they've drawn blood within the last month. I've had 5 tests for CBC, which is like your blood, your red blood cell, white blood cells. Then I had 3 tests for my C-reactive protein. It's basically an enzyme that your liver makes that tells you if there's inflammation. In my case, my marker's very high. When I went to the hospital, the reason they admitted me was because I was slightly anemic, my white blood cell count was elevated, there were some other things that were off on the lab work. Then I had 3 tests for my basic metabolic panel, which is like, your sodium, your potassium, all that good stuff. I had 1 test for my SED rate, 1 test for phosphorus, 1 test for magnesium, and then they also wanted to look at my celiac. I think they did a celiac, I don't remember. And then I had 1 in the hospital. They made me take a calprotectin. It's like a stool sample. They wanted to check for infection. When I was in the hospital, I had round the clock every 4 to 6 hours. They gave me a drug called piperacillin through an IV. So I had that every 4 to 6 hours. Then I was given 5 days of Augmentin, or what's commonly known as amoxicillin. If anybody knows about antibiotics, it gives you horrible diarrhea. It upsets your stomach. So I had 5 days of that. Then I had another 7 days on top of that. I've had 2 prescriptions for cream, a Proctazone cream 2.5. Then I had a lidocaine cream. And then I had a Procto foam, which is basically a little foam that you insert in your rectum and you spray it. It's supposed to help with pain. None of that unfortunately helped in this case. So went through all of that, and then I've had 4 to 5 visits with my primary care. And then I've also sought help through community resources, so I had an appointment for that. I'm supposed to be seeing someone tomorrow at my doctor's office to get help with their sliding scale program. That way, when I'm able to return to work, I will lose my health insurance. So this will give me at least a buffer for a year, because if I had continued working where I was at, I would not qualify for the sliding scale. So they're going to put me on the program, and I'll be on it for at least a year. But understand that once I go back to work, I lose my health insurance. And I can't afford private health care. Because people keep asking me, why aren't you getting private health care? Well, I can't afford it when I'm making minimum wage. Now, it's also taking a toll on me financially when I have to buy medications and supplements and things like that. This is everything that I've bought. I've had to buy an enema from when I went to the colorectal surgeon, and that was not fun. You stick it up your rectum, and it gives you instant diarrhea. Not fun at all. My amoxicillin, my creams, I got Preparation H for the hemorrhoids, anti-diarrhea medicine, ibuprofen. When I had the pain, I was taking 4 pills every 8 hours because the pain was so intense. That was the only thing that was relieving the pain, and I'm still taking it on and off. The doctor also wanted me to get omeprazole for the stomach issues that go along with the ibuprofen. And then because of the diarrhea, I have to take a fiber supplement, so had to buy 2 bottles of this. And I also have Epsom salts because obviously with an abscess, what's the best way to treat that? Sitting in a hot tub of water with Epsom salts. Now the last 3 days I've been in and out of the bathtub because I've had so much pain. It swells up, then after 5 or 6 hours it drains. It's excruciating amount of pain, and I don't think people realize it, and you won't understand that unless you're in my position. Nobody will know. Nobody knows unless you're in that position. So now I have to talk about why we're doing the GoFundMe. Like I said, I'm not able to work. I'm going to be having a surgery in 2 days. They're going to do what's called an examination under anesthesia. So they're going to put a probe in similar to an anoscopy, and the colorectal surgeon is going to look at it and say, hey, does this thing need to be surgically drained? Or are we doing what's called a fistulotomy? So if I have a fistula, they're actually going to go in, they'll clear it out, and they're going to put what's called a seton in, which is like a band that goes around and it closes up that fistulous tract, because if it's not treated, you can get infection, you can get sepsis, which I've been dealing with the infection side of this. So just realize that, and this is like, it's very not pleasing looking what a seton is. You also have to understand that even if I have this procedure done, there's a possibility that this could come back down the road. Fortunately, I don't have cancer. Fortunately, I don't have Crohn's disease, but this is something that's not very common outside of having a bowel disorder. So most likely caused by stress in my life. People don't understand, but that's really the main cause of this. But we're doing the GoFundMe because I've exhausted all of my resources. Between having problems with the car, 8 months without, a stable vehicle, I had help from somebody. Unfortunately, nobody here locally was able to help, but I had somebody out of state, and that kind of hit some bubbles. I'm still having problems with my car. I just, one thing after another, and I can't get back on my feet at this point, and that's the situation I'm in. I can't work right now, and I've literally exhausted all of my resources, my retirement, my savings, my tax returns. I have nothing. I am going to run out of food in a week, and then in 2 weeks, the electricity is going to get shut off. My internet is going to get shut off. I'm not going to be able to do anything. I won't have gas in the car. So I don't know what else to do. I don't wish this on anybody else. I need help. I am begging for help at this point. If you can't donate, $5, $10, whatever you can, that's fine. But if you're not able to donate, please at least share this with other people who may be able to help my situation. This isn't the only hardship that I've went through. I have lost my entire immediate family, and that's what makes this so difficult. My mother passed away in 2010 from breast cancer. Several years after that, my grandmother passed away of a heart attack. A year later, my grandfather. My brother took this pretty hard. He got involved with the wrong people, drugs. He was found dead in his apartment in 2016. And then my father passed away in 2019. And he was homeless on the streets.
The drugs and alcohol caught up with him. He eventually had cancer of the liver and bladder, and he passed away. So this is very difficult for me. And all I'm asking is for your donation, your help, and if you can't, please send this to people that you know, friends, family. I desperately need help. If I don't get this help, I won't even be on the internet anymore. Please donate. Please help in any way that you can. Thank you.